Hello, everyone, and welcome to day 4 Q&A of our Senior Dog Care Summit 2.0. So you've made it through the fourth day, and hopefully you saw some awesome programs as we had posted. Really fun interacting. We looked at some things that you can do for helping the nervous system. That was with Dr. Suter. And then Dr. Susan Wagner was really, really interesting with the sound and the vibrational, talking about how that affects individuals, ourselves and the animals with us. And then we got into the situation of discussing then the topics of euthanasia and helping that end of life process be more comfortable for everyone, and the different aspects of what you now have available compared to what it was 20, 30 years ago. Heads up, if there are any glitches in the system over the past few days, we have had some problems with the internet connections clicking out on us. So I'll just exit, I'll come back in. It doesn't take but just a few seconds, and then we'll be rocking and rolling again. So just heads up on that. I do want to thank our sponsors, the Vism Light, which is low level light therapy, and then Chi Dog, which is a food company that makes foods based on the traditional Chinese medicine philosophies. And so I promote both of those aspects of health and wellness, and hope you can, at some point in time, visit their websites and learn a little bit more about it that way too. All righty. So, the one other thing I want to talk to you about, if you have been having fun with the Senior Dog Care Summit and would like some more information, if you want to get into more detail, learn more about chronic inflammatory diseases, or specifically, I'm going to share some information with you about Lyme disease and what are the factors, the trifecta, I call it, that puts that in place so that it then becomes a problem. And so the four pathways of pain, then you can learn how at each of those pathways that you can intervene to help stop pain and why that's important to address all four pathways. A lot of other programs, one on cancer. There's just a lot of fun things that are included in that program. And they've got it set up for you to where you can do it in little increments and segments, not like you have to sit down and do the whole thing at once. And then at the end of the month, on the 20th is our first night timeline that we'll actually then get together and I can answer questions that you have about that. So I'm inviting you to join the Life Extend. There we go. The post-summit course, which is my Life Extend method. So it'd be a lot of fun. Alrighty, so I'm sure some of you out there got some questions that you want to have answered and get a little bit more detail or insight into something about with your animals or something that was on the programs. I'm happy to address those now. All right, while we're waiting for somebody to get brave, let's see here. Got to think of some of the topics here that we went through. All right, so I'm interested in nutrient and mineral testing for my dogs. How do I tell the difference between the different options? I want the most information. I went clean and ditched kibble almost a year ago, so that's really, really good. Did base it, the recent, okay, did base blood test then and recent blood work and all looks good, but I would like to know how their nutrients look. Awesome. So that's good. Yeah, so the test is done on a fur sample. That's the best way, because what we want to do is look at what's in the interstitial fluid, because that is your refrigerator and the cupboards that hold everything that's feeding all the metabolic processes, all the cells and tissue. You can't judge what's available to be used by looking at the blood, because the blood test is what keeps an individual alive at that very second minute. It you can't pull from that in order to feed yourself. In fact, the blood will actually pull from other reserves in order to keep it in balance. So the fur is the best place to find what the mineral levels are in the body, and then also if there's any toxic metals that are interfering as well. So you can access that from my website. So you can go to avafrick.com or lifeextendmethod.com and learn more about the hair tissue mineral analysis. I can do the test for you that way. If you want another option, there's also checkpup.com. CHECKPUP.com. And that's a company that I've worked with, and they have integrated all of my different aspects of interpretations of the hair tissue mineral analysis. There's a lot of different companies now that realize the benefit of this, and people are doing this kind of testing, and other laboratories that are offering it. But if the person that's doing the interpretations hasn't studied a lot and really understands the interaction of all those minerals, oftentimes the recommendations you get are not quite spot on. And I've seen this in some of the tests that have been presented to me for a new client. And they go, I already got the test done, and here's what they said. And then I look at the results and I go, boy, that's not exactly what's going to deliver the best results for that animal. So at checkpup.com, it has. Alrighty, so checkbook.com you can go to if you want a less expensive approach to getting that same kind of information. If you want to visit with me about it and you have a little bit more one-on-one, then you can go to my website and purchase it from there. And I've done the test all over the world because it's a hair sample, so that's easy to have that mailed here to the U.S. so I can send it to the laboratory and then get the test and then do the interpretation, and we're on the way. Cool. Anetta says, I have an older terrier mix that has eye gunk. What should I use to wipe, and what can I do to keep it from happening? All righty. So, several reasons this could be happening. Some of it depends on the breed of the dog and how the eyes are positioned in the head. So, that can be one thing. Another is if they're diggers and they go out in the yard during the day and they're digging in holes, and then they get a lot of grunge up in their eyes, or if they're running in the weeds and things like that, they're out in the fields a lot, and the pollen and just particles blowing up gets into their eyes. Then while they sleep at night, the part of the eye's job is to work that then into the corner so that it's trying to get it away from the eye. And so there's lakes where the tears will set, and then they'll work that to the inside. So part of it can be from their lifestyle. Um, so one thing I'll do in that situation is that I take a cotton ball with warm water, just plain warm water, and rinse their eyes out at night. That's a very simple thing, and a lot of times that handles it directly. Another reason that that kind of thing can start to happen is if the animal is older and the tear film is not as lubricating because their tear level has dropped, and so they tend to have a little bit of a dry eye. In that situation, what you would want to do is actually get some artificial tears, which you can purchase over the counter, and then put one or two drops in each eye several times a day, depending on how much of that happens. So that would be another option. There are other nutritional scenarios that could be why this is going on too. And you can also use eye rinse, like people that wear contacts and that kind of thing. You can use that to rinse the eyes out too. So, nutritionally, other reasons that that can happen is like if the pH of the body is off, then that may happen. Eye problems, especially the drainage, like what we call the epiphora, when that's happening, can also, and I know it seems a long ways from the gut, but intestinal problems can also have an indicator that's visual by that eye drainage. So improving the gut, depending on the type of discharge, rinsing the eyes, depending on what their lifestyle is, adding some tears, all of those could make a difference. Okay, so yesterday I recommended Romania. It is an herb that's good for adrenal glands. It looks great, but then ready not to use it if one has an enlarged abdomen from liver being enlarged, which I think my dog has. Should I use it? Well, um, I guess you'd have to, it says, which I think my dog has, enlarged abdomen. Okay, now it with Cushing's, because it's like being on steroids, what happens is that muscle tone gets weak, and individuals that have Cushing's or people that have overactive adrenals over time, they do get an enlarged abdomen. I'm sure you've seen people like that. And the dogs will get that way too, where it's more rounded and it kind of stands out. And that can happen also because of the whole chronic steroid working on the liver. So it can be a secondary situation. So I guess you'd really have to know a little bit more about the liver condition on the dog. I've used Romania for lots and lots of years and have not had any problems, but I don't want to say, yeah, go do that. And then there's more of a problem going on than what I realize. So also, varying doses, the quality of the Romania, that type of thing can make a difference on what happens once it's in the system. So sometimes reports that show up can also be that it wasn't a very good quality of the herb that led to that problem. But you can also use the herbs like the milk thistle, the dandelion root to help burdock. All those will help the liver as well. All right, Kayla has a 9-year-old Great Dane, began having intermittent right front lameness in January. Radiographs had no bone cancer. Uh, he did test positive for Lyme. Oh, and the doxy made him sick. Okay. So so first off, I would have him assessed chiropractically. So radiographically, I mean, I'm guessing they did cervical radiographs, although you said they only x-rayed the distal part of the leg. That doesn't seem, I mean, like with a Great Dane and with front leg, if you're doing radiographs, you definitely want to do cervicals because of the problems they can have with the wobblers and that. But also just general subluxations. It's not uncommon that there could be a compromised joint area in the neck that can radiate down, and we get what's called a radiculopathy. So it's a radiating pain down the leg, which is coming from cervical subluxation. And because the subluxations are only 1 to 3 millimeters, a lot of times that will not show up on a radiograph. But a good animal chiropractor who's certified and trained will be able to detect if there's not range of motion in that area and correct that. So an example of a story for you was a cocker spaniel that had come to see me, and the dog had had a chronic front leg lameness. And their traditional veterinarian and the specialist, they did the radiographs and everything and of the whole leg, and they couldn't find anything wrong, and they decided that amputation was going to be the solution for the dog to not have a lameness. Well, he's still going to be lame because he's going to be having problems gating because now he's missing a leg. And fortunately, she's like, that's not okay. So the dog came to me and I worked him up. He actually had cervical subluxations and things that we worked through chiropractically with some microcurrent. He had that radiculopathy where it was just pain radiating down the leg and made the leg hurt, but the pain wasn't coming from the shoulder or the leg at all. It was coming from up in the neck. And he still would have had the pain. They just wouldn't have known that it was there because the leg wasn't going to be there to show him that there was a problem. So chiropractic is definitely an option for you. Maybe cervical radiographs to make sure there's not something else going on, addressing any arthritis and inflammation that's there. And yeah, I'd start with that. I think he needs a little bit better diagnosis and a little bit more of a workup to know what all for sure is going on and where the problem is. Do I have a recommendation for a brand for the pulsed electromagnetic field for dogs? I would be using it for my Golden's energy level. Mm, when I started with that a lot of years ago, it was the original chamber of PEMF, and they would lay in there. So it's like an MRI, only it's therapeutic, not diagnostic. And that particular device is no longer available. I know they have pads and things that you can put on them, but I'm not in the venue now of doing the PEMF, so I don't have a specific company that I have as a favorite. So I guess you'll have to do that research on your own there. I don't have one that I recommend. I do the laser and the microcurrent therapy. Um, I also do the beamer. That I guess that's the closest to a PEMF that I would say. And it definitely helps. I've seen that work well. So I would say the beamer company. It's not the least expensive, but it definitely works. And it's similar to PEMF. It uses it to ignite it and start it, and then it runs a little through a different system, but that would be the one I would say. Any exercise to help a 10-year-old with bladder leakage versus taking prescription drugs? Okay, so for those guys, number one is chiropractically assess and make sure that there aren't mid-lumbar subluxations can lead to that problem. Number two is we kind of talked a little bit about this yesterday, some homeopathic products that I use that help with incontinence that you can do those products. So homeopathics can help. Acupuncture can certainly help as well. And sometimes incontinence. Oops. Alrighty, talking about urinary incontinence, homeopaths, chiropractic, acupuncture, making sure that he's not on any other drugs, which looks like you probably wouldn't be heavy into a drug. But I recently had one of my regular clients whose dog, um, you got to think what he had, a pancreatic attack or something like that. And they put him on trazodone and gabapentin and omeprazole and um, there were several compounds that he was given all at once, and right after that, the dog started with the urinary incontinence, and so it didn't go away right away, and still dealing with the problem. Then they decided maybe they needed to have a workup, just make sure there wasn't anything wrong with anything else in the body. His BUN came back slightly high, not that much, and the doctor had suggested that he was in kidney failure, which like no way. So I said, okay, let's back up here and when exactly did this start? And because they live in another state, so I'm not their traditional vet. I do their, the other nutritional workups for them. And I said, okay, so there's something that happened when he had the pancreatitis. What's the list of drugs? That's when I found out. They researched them all. Three of those actually had indicators of urinary incontinence. So we determined from that one of those compounds started it, and then his body just he hasn't gotten over it. So I just today I did some assessments with him to try to figure out what's the area of the problem and what do we need to do to correct it. Ended up pituitary and pineal gland were affected, so I've got a program of some things that we're going to do hormonal wise to help him get over that, and then some other things with the bladder. So there are many different options that you can go through. Sometimes the estrogen, there are even homeopathic estrogen drops and sprays and things that you can do. And sometimes it really is about having enough of the estrogen to improve that sphincter tone. But there certainly are a lot of other options out there too. Thank you. Okay, Jennifer wasn't able to be online today. Okay, can I stress the importance of senior wellness testing? Specifically, I have had several cat parent clients that were giving up on their pets, saying they were just old. Okay, so many older cats have hyperthyroidism, and it's such an easy treatment. Okay, well, you're very welcome, Jennifer. All right, so yeah, just to say that because they're old, that's your excuse is there are many, many, many things that can be done nowadays. And in reference to the hyperthyroid cats, the reason that actually develops is because many years of low calcium and magnesium. The thyroid needs a lot of calcium in order for it to function correctly. And when it doesn't get that calcium over years, now it starts to go haywire. And a cat that's hyperthyroid needs 250 times more calcium than a normal thyroid cat. That's how far behind they are. So there's a lot you can do for those. And there are so many new options now. So if we're looking at wellness, that doesn't just mean going to the traditional veterinarian and spending $700-800 on blood tests that come back and say, oh, everything's fine. There might be some of the tests in there that find that there's indicators of problems, but a lot of times the blood test may be normal, yet you're going, but he's not right at home. So that's where you do need to seek out that holistic practitioner, find a veterinarian in your area that can work with you or one of us that are online that are able to support. There's a lot of different doctors that do the telehealth now that can help you work through the situations that you're facing and listen to you and give you the time to be able to express what's going on and look at it from a different perspective. Sometimes like even I can get maybe down a track and you get looking one way. And that's where having other doctors that you can ping something off of and go, okay, what's your perspective on this? It sometimes opens up the window. So having your multiple doctor support base and getting everybody to work together is very, very helpful, and not just giving up on one and saying that they're old and that's why they're that way. I mean, even just like the older cats that appear to be arthritic and slow going, if you just have a warm, like a heating pad on low or an electric blanket that they can get and curl up in and help those old creaky joints to be more comfortable, that alone can help them a lot. So there's a lot of things that you can do for all the ages. And I know sometimes that the cost is, like, I'm flabbergasted. I had one of the folks that was listening to the Pet Summit that sent me an email about trying to figure out what to do with the teeth. It's like $650 for a dental for her small dog. And I'm going, wow, there's a lot of people that couldn't afford that. I'm kind of stuck back in the days when we did them for whatever it was, 125 or something. So I'm sure the 650 includes radiographs and some other things like that. But if somebody can't afford all of that, then they feel bad because they can't do what they would like to do because it is so expensive. So continuing to look for those other options is okay, and I encourage you to do that. All right. So I am on SSDI and am interested in the low level summit package, but didn't get my funds till Saturday. Oh, that you would have to discuss that with the Pet Summits team. I don't do the actual booking on those, on the pricing and collecting the revenue and all that. So if you can send your email to the Pet Summits team, and then there'll be somebody that reaches out to you and they handle that directly. But we'd love to have you. It's a part of that Life Extend Method program. Okay. All righty. Back to more about 9-year-old Dane. He has LARPAR. All righty. You're going to have to tell me what that one is. With hind end weakness, we do acupuncture. He's been limping daily since April. Now thought on Adequan. Well, Adequan is a glucosamine product that, it goes injectable versus going orally. So sometimes when they're older, although nine's not that terrible old for a GI system to not absorb, I'm sure he's on oral glucosamine chondroitin. I have had some where injectable Adequan made a big difference for him. I just don't know, I'd have to see the whole picture of everything he's on, and then try to determine if that was going to be something that would be beneficial, because at his size it's going to be a pretty penny to be given the Adequan injections. And you can always start it and run through its program and then decide if it's not helping, you can stop too. Generally, the program is that you do it twice a week for a month, and then once a week for a month, and then after that, once or twice a month, that kind of thing. So it is a reducing dose as you go, but it's only going to be effective and necessary to the degree that his joint viscosity is thin. The joint fluid viscosity is thin. It should be thick like motor oil, not thin like gasoline, and it will help that. And if there's anything within the cartilage of the joint is where that would help. How long do the hair samples last before they arrive at the lab? Well, actually, oh, shipping from Costa Rica. Oh, I just love Costa Rica. Um, okay. So, the hair sample actually is viable up to like 760 degrees. So as long as they don't get overheated, that information in the hair is good for a long, long time. That's why this is part of forensics. Like you've seen stories, I'm sure, on TV or YouTube or wherever, movies where they found hair samples in a car that was in a lake, and they pull it out and they find some hair in there, and then they find out what happened or who the person was because of that. Also, they've pulled up bodies that have been buried for centuries and then been able to take samples from them to find out what they died from. So the information that's locked in there, it's locked in there, and it's going to be there as long as the temperature, like it's not like super, super hot, 760 degrees. Now, it is the information of what happened, of what was there at that point in time. Once you clip it, that's the information you get. It's not going to tell you what went on 90 days later, but it is the information of that life up to that point in time. Which is better, walk a dog first thing in the morning before feeding or feed first thing before walking? Well, mm, okay, on that, I got two thoughts on it. One is that a dog that is very food focused, if you start them out in life, giving them their food and then taking them for a walk, that's what they think it is. That's the mechanics of their day. And so if you try to change it up, they hurry. Their walk is like super fast or short because they want to get home and eat. But on those that you feed first, and then especially if the weather's hot or if they're like one of those, it's different if they just stroll and meander along. But if they're one that's like moving along pretty good and you got hills that you got to go on, to give them a full meal and then take them out for a walk is not such a good thing. If you have an hour or so before you go for the walk and they have their full meal, that'd be fine. Otherwise, give them a little bit so it takes that edge off and then go for your walk, or give them some snacks and then go for your walk and then feed them. The one thing we want to avoid is the deal that they're out there walking and they become from the walk, even though it's a happy stress, they're kind of stressed, and then that's going to reduce their ability to digest very well. So it really depends on the personality and the mindset of the dog, their body type, their age, which one of those options are going to work best for you. Do deficiencies found in the hair analysis tend to correspond to certain outward symptoms? Everything. Everything that you see going on with your animal is because of what is not available to the tissue. So, anxious individuals, behavior related problems, fears, phobias, oversympathetic dominant, those answers are in the test. Generally, that's individuals that have an extremely low calcium magnesium level, but you want to know how low it is. Also, from that test, another thing that could cause that anxiousness would be a high copper level. And the copper can be high for a lot of different reasons, but copper can make one jittery and nervous. It can also cause aggression and unexpected behavior changes. Also, with those calcium and magnesium is low, that animal that gets worked up, they may be having fun, but they kind of get wound up and they can't wind themselves back down because it's not there. GI problems, digestive issues, that all shows up on the test. Protein assimilation, so issues with the weight, digestibility of proteins, that's there. Thyroid function shows up on the test. The degree of inflammation, so any kind of itis, dermatitis, colitis, gastritis, obesity is inflammatory, cancer is inflammatory. Being able to see on this graph what the level of inflammation is and then working to get that down, that alone is going to prevent a lot of future diseases that are inflammatory diseases like diabetes and heart disease and so many of them. Also, the dogs with the cruciate tears. Generally, before that happens, there's always inflammation. They've proven that in research, and that's published. Also, if you think about what keeps a ligament strong, you got to have calcium and magnesium and manganese. And when there's a lot of inflammation, all of those are going to be low. So that is a setup for dogs to have cruciate tears. And why does the other leg tear usually within 3 years in 65% of the population? Because nothing was done to correct why the first one actually happened. Because most traditional veterinarians and specialists don't have the data or the knowledge to be able to really look at, they're going to want to test what caused it to begin with. They know inflammation, but like how much inflammation did that body have? This is the test that's going to show you that. And it can oftentimes predict whether or not this animal is on the verge of metabolic syndrome or diabetes. There's indicators of kidney function that's on the test. And then we get the toxic metals, which can be the causes of many things. Mercury, which causes aggression and can cause nervous system problems, so tremors and seizures and things like that. Aluminum can be super high and cause allergies and GI problems and just a slew of other issues. Lead itself gets into the bone, can cause interferences with body function. It can cause seizure related issues. So, more and more research is being done about tissue mineral analysis testing, and a lot of more information coming out about how valuable this is to help in determining other disease conditions. And recently there was some publications about using this to evaluate dogs that are having seizures and what's showing up in the hair sample testing that could give us indicators about what to do for those dogs. Is there a big difference between Dasiquin with MSM and Dasiquin Advanced, which is only through the vet office? I don't know. I don't sell either of them. I'd have to look it up in the computer. I know, I think one of them, the levels of the glucosamine and chondroitin's a little bit higher. I think one of them, besides the MSM, I think the advanced also has the MSM. It might have Boswellia, it might have curcumin or something else like that in it. Avoid the ones with the extra vitamin C because most of these dogs have low calcium magnesium, and you start pumping them with vitamin C, that's going to lower the calcium levels. So you want to avoid, dogs can make their own vitamin C as they need it. You don't want to be giving them a whole bunch of extra. But I'd have to just click on the links and Google it up. I really don't know on those specific products. All right, Sandy has a dog with liver problems, injured cruciate and meniscus when younger, no surgery. Okay, we did all natural therapies. You watched the Dr. Lang massage. I purchased light therapy kit for pets. Your thoughts? Well, so depending on the surgeries that are done for the cruciate repair, it may be beneficial or it may not be. It can actually cause more arthritis. The TPLOs work fine, and a lot of that depends on how big the dog is, like body size. Like littler ones can get by without the surgery. Sometimes bigger ones need it. But there are other ones that I've had as patients that have not done the surgeries. We've done rehab, done the chiropractic, maybe some of the braces supported the tissue, and actually they did totally fine. The laser is definitely going to help because it's going to help keep down inflammation and strengthen that healing of that area. So that's really good. All those massage techniques are going to be beneficial too, as long as you don't, overstretch. You got to know where the limits are by paying attention and observing the behavior of the dog. So you know when they're saying, okay, that's enough now. And you go to that point and you don't go any further, you back up, maybe hold it, and then do your reps and all that kind of thing. But you can continue to help. So if the question was, can I do those things and help this dog that's older now that didn't have the surgeries? And certainly all of those can make a difference. Make sure and include the chiropractic in there. And that just depends on what the rest of the state of that dog's body is. There are some that can have problems and never really get the arthritis because they're not in a position to deposit calcium in places. So if your calcium magnesium ratios in that individual are good, then they may never develop arthritis anyway, even though there's an instability there. Do I have any recommendations for collapsed trachea? Okay, so yeah, some of the collapsed trachea can come about because there are breed idiosyncrasies. Again, we're still looking at, does that individual have the right level of minerals to protect that those cartilage rings, those C rings. So we're looking at calcium and magnesium and sometimes biotin and manganese. Is all that intact? Depending on how far this individual has gotten with a collapsed trachea, then your results are going to be a little bit different. You also want to make sure that part of the coughing isn't aggravated by it being dry. So one who's too sympathetic dominant is going to have dry mouth, and that's not going to have as much fluid. You're not going to be making the saliva. It's not going to have lubrication. So to do things that are helpful in lubricating can also be beneficial. Mullein leaf, you can make it into a tea. There's drops of mullein. You can use that to help with lubrication. There's other herbs that are good. with even using, got a mental block here. Okra can help with mucosal. It's a slimy plant. And so that can help with the slime. There's several different ones like that that you can use that can help with that. So you want to make sure that the tissue is moist in the area. That'll help keep the aggravation down. And certainly that they're not exposed to dust and other things that's going to aggravate them more. There's also essential oils you can put in diffusers that they can breathe in to help. And the other thing then too would be, all right, so talking about the collapsed trachea, making sure that there's enough lubrication for the mucosa, not being aggravated by dust in the environment. There are diffusers that you can use and essential oils that help to keep that area, the airway more open, keep the body relaxed. Because what's going to aggravate it more is if that individual gets excited and wound up, then they'll start to coughing. So not allowing them to be in situations where they get too tanked up. So those would be a few things. All right. Wendy's 10-year-old acts younger, plays, runs around with dogs half her age or younger. That's very good. One dog grabs at her hind legs at play. Yes, that could cause an injury. If they're just, if that dog's a healer and they're just like lightly tapping at him, then, and she's aware of it, uh, yeah, her, then if she's okay with it and she knows what's going on, that may not be such a bad thing. But if they're kind of grabbing at them as they're playing, I really don't like that. Um, yeah, I'm not fond of them doing that. If the other dog that's doing it to her is your dog, I would think of things like a water spray bottle that you don't want to holler at the dog because you want them to think maybe that your older dog was the one that did it, but maybe just squirt them with the water every time they start to do that. Um, that might be one way to get that other dog, unless it's somebody else's dog, then that makes it a little more difficult. You have to go to the park at a time when that other dog's there. But I agree with you. I don't like that on a 10-year-old. They can all of a sudden turn and twist things, and she's not going to recover like a younger one would. So, yep, I agree with you wholeheartedly. Not a good deal. All right. Kirsten has a 12-year-old golden. 1 week ago, his breath started smelling. Oh, okay. So bad breath can come from the stomach. Gases in the stomach bubbling up. It could totally not be a tooth. 6 weeks ago, we got compliments at the vet for his teeth. The senior blood panel was good. He's acting great, healthy, no issue. So this is weird. Any thoughts on gut biome? It may not be that far down. It could just be the stomach. So one would be, has he gotten nervous, like more nervous? Because one who's nervous, then sometimes they'll get the gases bubbling up from the stomach would be one thing. I would also want to make sure that he hasn't picked up any bad habits of eating any kind of, like, if the season changes, I don't know if he's eating any kind of manure or droppings in the yard that's making a difference in his breath. Um, yeah, the vet just looked at him and said there's not any abscess tooth. And also, if there was a tooth that bad to make him smell like a carcass, then I would expect that he wouldn't be eating quite right. You'd see him holding his head funny, eating off to one side. My thought on this is it's bubbling up from the stomach. You could start with a little bit of chlorophyll. Standard Process has some good chlorophyll pearls that have like really, really good quality chlorophyll, but you could get some chlorophyll and start with that and see if that makes a difference. You're not saying that he's eating grass. A lot of times when they got stomach problems, they'll start eating grass to actually get the chlorophyll because the chlorophyll is very soothing, but that may not be the case. Yeah, here on the farm, you can have the animals going out all of a sudden and they found something tasty. But I agree that that is pretty weird with everything else going good and him acting so good otherwise. The gut biome thing, that's would be looking a little bit further down. I don't think that's what you'd be smelling on his breath. It'd be more like other lower bowel problems. Okay, so Patty's been told that chiropractic isn't recommended for dogs with IV with the intervertebral disc disease. Okay. So That I don't know who told you that, but the person who told you that probably wasn't a certified chiropractic veterinarian or certified animal chiropractor. There are times when you definitely would not want to do anything aggressive in an area, but the reason that those situations can occur is because the joints on either side of that have not been mobilizing themselves correctly. So the IVDD comes about even though there's breeds that are more prone to have it, but there's still been spinal vertebral motor unit problem going on for a period of time before, and some aging in that disc as well before the real problem happens. So I've done, I mean, like for over 20 years. What is it? Since, yeah, like 25 years now, been doing chiropractic. And I mean, I invite the dogs with that kind of a problem to come in so I can really help them. And a lot of times there's other therapies that I do. One of the things I do recommend is if you're suspicious of your dog having IVDD, is not to allow the traditional veterinarians to like think that the first thing they're going to do is take x-rays to prove their point. A dog that comes in that's in pain, is the right breed, is kyphotic, is dragging their legs, you probably pretty well got this going on. Unless it's so bad that you are going to go to the specialist and you're thinking you're going to do surgery and you're going to have an MRI, that's different. But I've seen some that came in walking and they decided then that they were going to do, they're having the problem, but they could still navigate. They do x-rays, they put them on the table, they stretch them out, they lay them flat, and afterwards the dog was totally paralyzed. So I do not demand radiographs. I don't want to do that on one that's an acute IVDD episode. I want to get the swelling down, the inflammation down, get the other joints moving, do some therapy, and then we can work at finding out a little bit more about what's the status of the disc and what does the picture look like. But if they're walking still, that's the last thing I'm going to allow some technicians to do, putting them on a table to try to get a perfect x-ray and risk the fact that now you actually do blow that disc and the animal's paralyzed. All right, so Wendy exercises her 10-year-old. They walk between 1 to 5 miles a day. Oh, you divide it up for 2 to 3 hours. Okay, seems to enjoy. That's totally fine. Does pant. Okay. I mean, the panting can be seasonal too. Obviously, if it's summertime and it's a little warmer, then there might be more panting. Um, but just getting the heart rate up can cause them to pant. The dog doesn't sit or lie down. Yeah, so it sounds like she's okay. The things you would look for is that her gait got excessively slower. That means she's wearing out. Number two is if they start turning around and looking back where they came from, like, I want to go home, then that's another sign that it's 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 already gone too far, because now you still got to walk back home. So you want to make sure that you don't get out, because you always got that distance back. So don't go too far when you're trying to decide. Okay, stage 2 heart murmur, that's not too bad. That's probably not the reason for the panting in that at a stage 2. There's not really a terrible leakage, but I mean, you wouldn't want to. I would kind of start to look at what point in time of the exercise program does the panting begin. And then you do want to exercise because that's going to help strengthen the heart muscle and that's going to be beneficial. So to do nothing wouldn't be helpful. I think you're doing okay with that. I would just assess the temperature, the level of humidity, also, the time of day when the eating, I'm sure you've kind of got that worked out. Like the fuller stomach is, then that's going to press on the diaphragm. And so you're going to have the likelihood that the lungs then can't expand as far. And so it's going to be shorter breaths, which could set them off to panting too. You also, if it's warmer, you could take a spritzer bottle and just spritz her off and mist her. And then if the air is blowing and that blowing, it's like a little bit of an air conditioner kind of an effect. So you could do that as well to help them along. And I'm sure you take water, but sometimes the dogs, when they're out and if they're panting, they don't all necessarily want to drink, but you certainly could spritz her down and cool her off too. But well done for doing that with your 10-year-old. That's great. All right. So Denise says that, and talking about dogs with Cushing's, take a prana pets Cushing support. Oh, adrenal balance, immunity blend, melatonin, and lignans and CBD. There's a lot of different ways to address the Cushing's. I myself don't. Uh, I do in a. Okay, so there are a lot of different programs that can work for some dogs. I don't treat everybody the same, so I don't just say, oh, because it's Cushing's, you do these 5 things and that's going to make it better, because maybe that individual needs more liver support. Maybe one likes herbs and another one doesn't like herbs. Maybe the immune system's totally fine in one, but not in another. So melatonin can work for some. Some need the melatonin. That's part of helping to regulate serotonin in the morning, melatonin nights, your turn off, your turn on. But not every animal that I test with Cushing's has a problem with their melatonin levels. So there's a lot of different ways. And I'm sure, that is a good blend of things that can work, but not every dog, every body is going to want that program. So you have to decide which ones work for your animal, or have somebody that can do the actual one-on-one testing, doing a muscle testing, kinesiology of some type, some kind of a bioresonance program, or the different systems. There's Quest 4, there's Oberon. Both of those can do testing against a product on a sample, and also then can create your own specific blends too, homeopathic type blends. So a lot of different ways to go at it. Is using a stainless steel bowl for our pet's water okay? Yeah, as long as it's not aluminum. Does that carry any metal toxicity? Stainless steel should be okay. I actually prefer glass, is the type that I think is the best and the safest way to go. Stainless steel, though, is as long as you know it's stainless steel and not aluminum. If it gets rusty, if it's very lightweight, then it's probably aluminum, and that wouldn't be so good. But and then if you're putting fresh water in there every day, or twice a day, that would make a difference than if it's a big bowl and you fill it up every few days and then it sits there. But glass is still my favorite. Can you use colloidal silver on the newly formed interdigital cyst? It's very small. My dog isn't messing with it. What else can I use? So colloidal silver may work. I use it more like for as an alternative to antibiotics, as an antimicrobial, because you can spritz it in the mouth, you can use it in drops and give it orally, you can put it in the water. An interdigital cyst, my thoughts would be Epsom salt, betadine soaks to try to draw anything out of there. That's definitely my first. Depending on how big the cyst is, you can use bloodroot on there to actually cause the cyst to be dissolved. So I would be looking at that. There's the dogs that have the interdigital, where it's the abscess that forms and it's red and they come and go. And those situations, doing the soaking, the topicals like aloe vera is really good for the healing. I love the Epsom salt soaks, and the with the betadine in it to help with those, and then drying their feet off really good. There's some essential oils you could use in that. And the colloidal silver can help from the infection aspect of it as well. Is there anything I can do for a dog who's been neutered at only 5 months? I'm currently giving glandular support. Okay, that's good. And Nordic fish oil, generally for ones at that age, it's okay, as long as they're in this pattern that I see on my TMAs. There are some that if they're in so the typical pattern, it works good for the oils. If they're in what we call the 4 low pattern, then you don't want to add oils. So long-term health, at least he wasn't neutered till he was 5 years old. It's the real problem is those that are neutered when they're like 8 and 9 and 10 weeks old, like under 3 months and up to that point. That's where the worst of the problem is. At least 5 months was a little bit better. But there are some programs that you can utilize, different homeopathics and products that can kind of replace the hormone, like Standard Process has some ones. And oh, there's a lot of different companies out there that have hormone derivatives that you can use to try to help provide them something that they're missing along the way. All right. On day two, there was a vaccination question, went out the whole way. Where to go for the studies and literature? Can I get the website? Oh, okay. Okay. Good that you're titering. So that website is Dr. Will Faulkner, and it's vital, VITAL, animal, ANIMAL.com, vitalanimal.com. That's the website that will give you more information about the vaccines and the hypervaccinosis. And he's got some training programs for you to learn about everything with the vaccines. There's research publications that he has for you. So there's a lot there. But good job on doing the titers. That's great. Oh, thank you. Thank you, Sandy. She says exceptional subnets. Thank you. I would like further information on certification for canine fitness. Okay. Um, So there are different programs out there that you can do. There's the Fit Pause program. So you can look them up. They've kind of changed over the years. When I did it, it was out in Colorado, but now I think it's done through Chattanooga, Tennessee University. And it may be that you have to be able to be there. I don't know if you can do it all online. It was like a live program before. I do have an online program for canine fitness and a certification. There's a program there. It's through e-trainingfordogs.com. You can go there and there's that program. Um, I know of some others. I can't think of the people. They were students that I had in some of my nutrition courses and that do some other fitness training programs too. Those are just the first two that are popping in my head right away. But also, even like Laurie Edge Hughes, she has some programs and things that you can get off of her website. So there might be some information there that you can click on and then you download and then you watch the videos and learning how to do the different exercises. I also have it's on a flash drive. It's a whole video program of exercises that go through different body zones. So the upper body, the back, the legs, neurological problems. It goes through all aspects, and you can just click on little intervals. And so that would be another option for you too, to have something that you can watch. And kind of like in the old days when you had the videos and then you had the stretch exercise programs for people, Tai Chi and all that kind of thing. All right. So your 17-year-old peak only circles a lot. So he goes to one direction. He's getting deaf. He's definitely getting exercise this way, but doesn't mean his brain is just gone. Oh, okay. So he could circle. So he circles one direction, which isn't uncommon. Sometimes it can be that one half of the brain isn't working as good as the other half. Certainly, that's a possibility. It may be that his vision is better in one eye than the other, and that makes a difference. It also could be that maybe he has subluxations to the opposite side that he doesn't circle to, and the only way he can comfortably circle is the opposite direction. So it may be that he needs to have some chiropractic adjustments done. There are a lot of different possibilities that could be why he only circles one way. Yeah, so you'd have to do a little bit more hands-on check and have somebody help you with that. What are recommended brands for trimmers to use on a Yorkie's pads to trim fur that prevents floor contact? Well, you certainly can use scissors if the dog's, like you can use scissors and just clip there. Otherwise, you can actually use for a little dog like that, you can use like trimmers that people would use for their beards and their noses and they have some that are far dogs, but a lot of times they're more expensive just because it's for the dog. But you may have a set of clippers there that are already narrow that you could use in between the Yorkie's toes. Because I'm guessing maybe you didn't want it, you wanted it closer than scissor cutting and you don't want to nick them. So that's what I would look into. I'd look at some of the regular people for trimming beards or nasal hair and thing like that, and see if you can't find a set of clippers that would be small enough to get between the Yorkie's toes. Thank you for that. Any more out there, Gindi? Okay, I'm back again. Alrighty, so looks like we're gonna wrap up our fourth day of our Senior Dog Care Summit 2.0. I really appreciate everybody hanging in there, being a part of this, and encourage you to sign up for the Life Extend Method post summit program. You'll get a lot out of it, especially if you're somebody who wants more detail. You want to have a more in-depth understanding of the senior life and all these different things that's going on. You can go to the Pet Summits, click on that, and get a little bit more of information. We got a little video that'll give you a short clip about some of it. So I would love to have you in the class. It'll be fun. And then at the end of the month, we'll have a couple evenings where we get together and talk about things. So that would be awesome to have you as part of that. I want to thank our sponsors again, the Vism Light and She Dog, for helping promote the program, being there as sponsors that allow Pet Summits to be able to continue what they do and allow you then to have all of these free presentations. For all of the doctors, the presenters who gave up their time to do the interviews with me or put their programs together, it is so valuable. And it's obvious to you, I know, that the doctors that are doing this and the professionals, the nutritionists, the therapists, everybody, that we have a passion for helping to share what we know and wanting to get more people on this holistic venue of being able to help their dogs this way and their animals. So my thanks go out to everybody who's helped put the program together, and certainly for the team at Pet Summits. They are so fun to work with, so helpful, genuinely great folks. And that's why this program has continued for so many years, because not saying that everything has been easy all along the way, but they had this vision for themselves in this program and they didn't want to give up. And they have continued to pursue and try to figure out ways to make it better for everyone. So my hat and kudos off to all you guys who have been there in the background, making this program available for everybody and keeping it going, and working with all of us doctors who do the programs and those who are contributing to it. So as always, it's a fun time. And I thank all of you pet parents out there for being a part and making this fly. So if we don't have anything else, then Gindi, if there's nothing else then for us to do with today, we will call it a summit. So give your critters there a hug, and for Dr. Ava, a kiss on the noggin. We'll see you next time.